Hello and welcome again, ladies and gentlemen, to another episode of The Young Guy International. Our mission here is the same, creating a socially connected world by diving into deep, captivating stories from the people that shape our world. Thank you for being on this journey with us this season of the different conversations that we've had from the beginning to where we are now. Today with me, I have an interesting guest that I want to talk to you about. But before that, I want to continue to urge you to like, share, and comment on this video if you're watching. But if you're listening in, continue to share it on the different people that you think will gain value from the conversations that we will be having. Today with me, I have the founder of MedInclude, Seun Adetunji. Welcome to the Young Guy International podcast, Seun. It's a pleasure to have you here, and thank you for gracing us again with your presence, but not only that, sharing your experiences, because I think for our audience, your journey, your experience, and the advice that you're going to share today is going to be great.
Looking forward to our conversation.
Before we get into sort of the depth of all these interesting things, what I've been doing for the better half of the Young Guy International is asking my guests to tell me or to teach myself and the audience one or two things from their culture or from their heritage that they think would be valuable for us to take in and to break the ice for our conversation today.
That is an interesting start to the conversation. So I'm Yoruba from the west of Nigeria, and we have so many interesting things. So many. The Yorubas are they're very deep people culturally and language-wise, and they use language in so many interesting ways. I'm trying to think of which one to share. So maybe one that comes just randomly to mind for me is a proverb that means, so the proverb says, or the saying goes, Kojuma ribi, Bubara logun, which literally translates to, for the body not to see evil, for the eyes to not see evil, the whole body is the medicine. And that might not make a lot of sense, but when you sort of peel back the layers and unpack it, what it's really saying is you have to stay agile, you have to stay nimble and ready to, get on the move if you don't want to witness bringing it back to work and business, or even life generally. If you don't want to, witness negativity or pessimism in your business, in your life, you have to be agile enough to look for and create the realities that you want to, experience. So it's sort of a tricky way to get to an endpoint that's really meaningful, but that's something about the Yorubas is they use words, like I said, in ways where you really have to think to unpack and understand what they're trying to get at.
I think that was a good segue for us to talk about what today's conversation is going to be: health and your journey in the healthcare system. And not just that, but how you were able to take an experience into creating something from an entrepreneurial lens to be able to impact, and not just impact, but elevate the lives of healthcare individuals, but also those that go in seeking healthcare but don't have an understanding of what exactly the best way of information to be received can be. And I've seen that, especially working with you, and how much of your journey has been revolved around this. And my first question to you is around MedInclude as a platform. What is it and why MedInclude?
Well, first of all, before I go into that, yes, we did work together, and might I say that it was a great experience working with Darren. So thank you for sharing of yourself that way. So why MedInclude? I mean, some of the story. I was at some point in my life caregiver to my grandmother, and I witnessed firsthand that frustration that patients, feel, that people feel when they don't directly understand and cannot directly contribute to, their healthcare conversations and have to rely on someone else. And that was a few decades ago now. And come, 2020 or 2019, when I started to work and found myself working in healthcare, specifically in the oncology space, I was reminded of my personal experience with my grandmother because I witnessed again that frustration with the patients I was supporting at the time, and just seeing the overwhelming amount and overwhelming volume of medical instructions, information, context that the patients I was working with were dealing with. Coupled with the fact that a lot of them were on some kind of medication that would make them groggy. They were tense already about their medical condition. And now I have to also worry about trying to find meaning to all of this instruction about what to do outside of the hospital or after seeing their healthcare provider or specialist. And so at that point, I thought to myself, well, it's been a few years since I was caregiver to my grandmother and witnessed that myself. Surely there has to be a way now in the 20th or 21st century for patients to more easily understand, process and access their health information. And so was helping my patients at the time look for how a tool, a platform to better process their information. And unfortunately at that time, a few years back, came up with nothing quite like what the patients were saying to me that they needed. And that's what birthed the idea of MedInclude. And so MedInclude was actually a co-design project with the patients and the providers I was working with at that time. So oncologists, cardio oncologists, stomach cancer patients, gastrointestinal cancer, were some of the stakeholders at the time that I worked with to co-design what a platform could look like that would add meaning to the process that they were already in and experiencing. And that's how MedInclude was born. It's been a few years now, and we have gone beyond just thinking of medical terminology that is cancer related to other areas of healthcare as well, and now support all kinds of physicians, specialists, and patients too.
You mentioned something quite important, which was co-designing with the different, I'll quote unquote call them stakeholders in the healthcare system, oncologists, cardiologists, and now growing beyond that. How important was it for you to be able to work with them to co-design the solution rather than you coming up with this solution in your mind and simply dumping it and forcing people to take it on?
Very important. Very important. In fact, I would say that that's one of the defining ingredients in any entrepreneurial recipe. Co-designing MedInclude with the stakeholders that I mentioned was absolutely helpful to better understand what the needs were, not just from my own perspective, because like I said, I have been caregiver. I wasn't the primary patient myself. This was decades ago. Even though I worked in healthcare at the time with, patients and witnessed some of their experiences, it still wouldn't account for that first-hand lived experience. And so were I to go off into a lab or into an office and design what I think would be the right platform, that might have been one way to do it, but then it's gambling on whether or not that actually would eat at the heart of what's needed by the providers, so the physicians, the specialists, by the patients as well as the caregivers. The most important thing I think that I did in that journey at the beginning was really to engage with the people who would use the platform and say to them, what do you need? What are you using currently? What's not working in that process? What do you wish you had? And so taking all of that information at different points in time and sort of building a collaborative effort around the project to really infuse the needs, the lived experiences, even the wants of the people who would actually use the platform into the building process. I think that really helped us to build a platform that, one of the proudest things for me about this journey is when I speak with patients or providers and they share with me, how helpful this is. Like, this is what I needed all along. Like, it's so fulfilling to hear that. And I think that is an outcome of having had those initial conversations at the onset with them.
And what have you seen has been the biggest value that because there are two key stakeholders that you're dealing with. You're dealing with the hospitals, but you're also dealing with the patients.
Correct.
So what has been the biggest value to both the patients and to the hospitals, the oncologists, the doctors that are sort of giving this information?
Right. So they're sort of interconnected, the value to those two parties. So for the providers, the physicians, the hospitals themselves, in my experience, I've seen that when providers in their current state share information with patients or caregivers as is, in most instances, it's got medical jargon, some technical terms, almost always in English. They don't get as much engagement input from those patients as is sometimes necessary to reach a medical decision that is most beneficial to the patients, because they're not getting the full engagement that they could, or interaction that they could from those patients and caregivers, simply because the patient, one, might not understand fully, or the consultation time is so short that things just are moving too fast for the patient to process. And for most of the providers that I have engaged with, I find that they truly want their patients to be better. They truly want their patients to contribute and listen to these patients and understand their points of view, their lived experience, how they're feeling, how their body is reacting to whatever medication or not. But there's that barrier of medical jargon, being time bound in the consultations, even language barriers as well, that limits that engagement between providers and patients. And so that oftentimes also can snowball into dissatisfaction for the providers. I met a provider at one time in the KWC here who told me that prior to MedInclude, when sharing information with patients who don't speak English as first language, they would information or instruction about how to use medication at home. They would draw a picture of the sun and put tallies beside it to say, this is how many pills you take when the sun comes up. And then they would draw a crescent moon and say when it sets, when the sun goes down. This simply because there's that barrier. And so what that incident or that narration of that provider's experience showed me is providers truly really care about the patients they're helping, because why else would a physician become an artist if they didn't actually care about helping this patient understand and get the best care and whatnot? But they're also limited by time, by resources, by budgets, and long queues of patients waiting at their offices. And will sometimes want to speed things up. So not all providers can do that. With MedInclude, that provider is now able to, communicate with their patients in a more seamless, straightforward way. And for patients as well, they're now able to take information with them back home that they can review and revise and revisit whenever they need to do so, where before they needed to rely only on their memory. And we know that human memory is one of the most unreliable things. And so now those patients can refer back to, the instruction that they've gotten in Spanish or Swahili, right? And go back to say, how many pills am I supposed to take in the morning, or when the sun sets, or am I supposed to dress this wound that I have? And read that in simple, English or in whatever languages is better for them.
And I can tell from that whole experience, one of the key core values that I'm getting from you, but also from MedInclude, is this aspect of equity and diversity, which I think is at the core, correct me if I'm wrong, at the core of the work that is being done.
Yeah, I mean, you're not wrong. That's certainly one of our core values, is health equity. And really supporting providers and patients to improve healthcare access, health equity for all patients. Beyond that, or related to that, are also values around really agility and efficiency within the healthcare system. As you very well know, technology is moving at the speed of light, and healthcare is, in my opinion, one of those sectors that can greatly benefit from use of technology. We're already seeing the benefits in a variety of ways. I think that leveraging technology for healthcare, for the healthcare system, can, go beyond just health equity and access to actually improving the current processes that we have, bridging any gaps, leveraging opportunities within the existing system, and ensuring that the healthcare system and those within that system are now utilizing their resources to its fullest capacity and ability. So, we're now, with technology like MedInclude and so many others, AI scribes and whatnot, we're now reducing things like admin time or admin work time for providers and helping them to really focus on caring for the patients, which is what they love to do, and so many other benefits. So I think that in terms of core values and what we're really driving at, it's health equity and access, as you rightly said. In addition to that is also is quote unquote supercharging, as we say in tech, supercharging the healthcare system with the benefits of technology and artificial intelligence as well.
True. You've mentioned how you've sort of helped the barriers of the healthcare system and the healthcare individuals that you're working with. But building this platform, I'm sure, has not been easy. What barriers have you faced in building this technology giant that I believe it will eventually become?
Darren, where do I start? And how much time do we have? So many challenges as with building any other kind of startup, but even more so in healthcare, I think. I was at an event at some point, I think 2 years ago now, and someone else, another founder who was in healthcare, made a statement. It was on stage talking and said he believes that a lot of people that go into healthcare as entrepreneurs are naive and wouldn't do so if they were naive. And I kind of agree with that statement because as someone laid out, the trajectory and all of the challenges to me or for me, I think I might have said, does someone else want to take this on and have me support them? Because I truly believe it's a problem space that needs to be solved. And so maybe I might have found another startup and joined them and help them solve the problem of communication in healthcare. But here, all to say that there's been lots of challenges along the way. One of it, and I think the most prominent one, really has been around talent and finding the right talents with limited resources, as you very well know, and building up the idea from just an idea into an actual product, into a company, into a business, and everything that comes with it. Startups are very limited, at least many startups are very limited in funding and would rely on grants and bootstrapping and being self-funded and whatnot. And that, for the most part, has been MedInclude's journey. It's been really thinking creatively about how to stretch as much as possible the funds that we have to get us to a point where the business or the company in and of itself is self-sustaining. It is certainly a journey, but I'd say finding talent has been one of the biggest challenges. Another one that comes to mind readily is just the challenge of breaking the status quo, for lack of a better way to put it, within the healthcare system. Healthcare is a bit rigid, to put it mildly. It's a bit rigid in terms of processes and procedures. Some of it I understand because I feel like knowing that the healthcare system and hospitals take my data and privacy really seriously gives me comfort. But on the flip side as well, some of that process really, I think, in my opinion, limits the speed of innovation and innovation adaptation and even just mobilization within the healthcare space. And that has certainly been a challenge as well. It's just trying to help people within the system better understand how technology such as ours can benefit and improve their existing processes. Because even in the case that they do, in some cases, they're like, yeah, this is great, but it would take so much to change what we already do.
Yeah.
So we'll just stay where we are, which is interesting. Change is difficult in every area, but I think even more so in healthcare. And that has certainly been a challenge.
I see. And on a more broader perspective now, for a young entrepreneur who's watching, who's looking at you and your story and listening and saying, that's interesting that she has had these challenges or these barriers. How would you advise someone, starting up, trying to get things out there that has these barriers to overcome them and to not look at them as obstacles to stop, but as a stepping stone for something greater?
Right. That's a good question. I think, and this might seem out of left field, but I think having something else outside of what you're building is important. So if you're an entrepreneur, you're building a startup, you've got this great idea, I think it's so important to have something else that is meaningful to you or important to you outside of what you're building, whether that's your friends, that's a hobby, that's your family, that's school. I think that can help bring balance and give you sort of a broader view of life generally, which really our views of life and living impacts what we're building. Everything we do is in relation to how we are perceiving the rest of existence. And so I think it's important to have things that excite you and bring you meaning and joy outside of what you're building, because then you are less likely to fall into the startup crack of like, this is not working, therefore my life is over. Right? Like I've got this obstacle, things I've been stuck for 2 weeks, therefore my life is over. And so I think that's really helpful to have that. Something else that I think is helpful, another mindset that I think is helpful to have, is to really be passionate or really work on something that you're passionate about. If you're working on a problem or project or problem space that you're not really passionate about, you're not really interested in solving, it can be very easy to dump, quote unquote, your idea after the first 2 obstacles. Because you're like, I didn't sign up for this, and someone else says this is not as important to me as I. But if it's a problem space that you're really interested in solving, you're really passionate about, I think imagining and envisioning that end goal of what the world could be like if this problem were solved would keep you going. It certainly keeps me going. Because then I'm not married to where we're at in any space in time, right? If something's not working, then it's easier for me to pivot because we're going somewhere. There's a final destination. It's not about the now. It's about the problem that we're trying to solve. Another saying, just to add the bonus, that the Yorubas, which is the tribe that I'm from in the west of Nigeria, another saying that we have is Onokon Woja, which means literally there are multiple routes to the marketplace. And so if the final state is, in this case, the marketplace, and you're going in one direction, there's a roadblock, you can pivot and take another direction. And as long as you have that vision and that passion to help build that final marketplace, or in the case of a startup, to help build what you think the world could look like with this solution or with this problem solved. Because it's not about the solution. With this problem solved, what could the world look like? If you're really passionate about that end state, then you're going to find wiggle room wherever you can find it. And so ultimately, to say, work on problems that you're interested, that you're passionate about, not just interested in, but you're passionate about.
Wow. And before I talk about passion, because I'm really intrigued by that, one thing that I've seen many of my guests have talked about since the start is they always say, fall in love with the problem.
Right.
And I've seen that pretty clearly in your journey as well. As it's about the problem and how, yes, if this problem is solved, what will the world look like? What will this community look like? What will X society look like? And it's pretty interesting to see that all entrepreneurs that I've spoken to have the same thinking, have the same mindset. But on the topic of passion, everyone likes to throw this word around. Oh, find what you're passionate about.
Yeah.
But how do you find what you're passionate about? Is it discovered? Is it something you're born with? I know it's a fully loaded question, but
I know.
From your experience, what do you think?
That's an interesting question, Darren. How do you find what you're passionate about? I think when you find that question that keeps you up at night and that you dream about, then you know you're on something. Like you just can't let go of this question, and it just nags at you like, why is this way and not that way? If I may say, I think we all know, I don't know if we all know, but I hope we all know that not everyone is cut out to be an entrepreneur. Not everyone can be an entrepreneur, and that is very okay. That is A-okay. But as an entrepreneur, an entrepreneur is different from a business person, by the way. As an entrepreneur, I think that what really drives many successful entrepreneurs that I've studied and read and that I follow, excuse me, has really been the idea of changing the world in some way. And it doesn't have to be on a grand scale. It really can be as small as within my group of friends. Like, what is the one thing that we do that I think we could do better? Or within my community, what is the one thing that is a certain way that I think can be better? And then if you find that whatever you do, you keep coming back to that question, you keep coming back to that problem. In a lot of cases, it's something that you've experienced yourself or that you've seen. In some cases, it's not. But if you find yourself, continuously dreaming about and asking that question and, spending time on it, perhaps you're onto something about that gives you passion and might be an interesting start to an entrepreneurial journey for you.
And I like that you said that, because I've also seen it in your journey as well, where it was sort of from an experience to a passion to something that kept you up at night to now actually going out and solving it. But I want to go back a little bit. Has Seun always wanted to be an entrepreneur?
Oh.
What were her goals when she was younger? Is that
so? When I was younger, I always wanted to be a lawyer.
Okay.
I'm like, I'm going to be a lawyer. That obviously did not pan out that way. But I come from a long line of entrepreneurs, female entrepreneurs specifically. My grandmother, my mother were entrepreneurs in so many different ways, and grew up watching them and seeing them and helping them with different businesses at different points in time. I didn't think specifically, I didn't sit and think I'm going to become an entrepreneur. I think it's just part of the way that I was brought up and who I am. Before MedInclude, I think I must have started no less than 5 businesses.
Wow.
All of which have failed, by the way.
Okay.
Giving me or leaving me with lots of valuable lessons. But that's besides the point. The point really is I think I've been I don't know if it's, I don't want to, okay, I'll pause and backtrack a bit. I think a lot of it has to do with what I was exposed to growing up. And seeing, like I said, those women before me be so entrepreneurial and strong and be their own bosses and whatnot, and that just stayed with me. I'm also someone who is really good with spotting problems and patterns, and at any point in time. So there's also this foresight personality type test, and I did it at some point and find that I'm an ideator, which I absolutely agree with. At any point in time, Darren, I have 3 to 4 business ideas. So if you want me to point out several problems to you within society, small or big, that you can latch an idea or business onto, I'm your person. So I think that's always just also been where I am. Like, I am able to spot patterns really quickly and really easily. And I'm also very solutions oriented, right? I'm like, so what do we do? So this is a problem. What do we do about it? Like, I would rather create something and use my hands and be really hands-on and roll up my sleeves literally and say, what do we do about this? Versus just spot the problem and leave it at that. And so I think when you combine all of those different things, my upbringing, the fact that I would self-identify as an ideator, and being really solutions oriented, I think it's a natural recipe for being entrepreneurial and being an entrepreneur. And so I'll say I didn't really sit. This is a long-winded way to say I don't really sit to think about it and say, I want to be an entrepreneur when I grow up, because I didn't even know what that is. I just knew that, this is what I love to do. This is who I am really.
And you said you grew up around entrepreneurs, your grandmother, your mother. What's one trait that you noticed in them? I know you said you're an ideator, but what's one trait that you noticed in them and that
they're
you've
go-getters. They're go-getters. Like, they want something, they're gonna go get it. Like, they're so super hardworking and super hardworking go-getters. They don't wait around. They don't wait for other people to solve the problem. They're not talkers. I'm a talker.
They're doers.
They're doers. They just go and do. They just go and do. And I'm so grateful that I've got some of that as well. And I'm just like, what are we doing about it? Like, there's a problem. What are we doing about it? So yeah, I'd say that's a common trait.
I see. I want to pivot a little bit to now the ecosystem that has helped you. Because you talked about, yes, your upbringing, the personality that has led to all this. But a lot of times the ecosystem that you're in plays a huge role in what you end up becoming.
Absolutely.
In Waterloo, Kitchener, this region is dubbed as one of the most entrepreneur innovative, actually, regions in the entirety of Canada. How has being in an ecosystem like that helped your process?
It helps so much. It's so much. There's so much support within the Waterloo region. One of the reasons, actually, so I'm a Waterloo alumni, and I'm an alum from the Conrad Business School. Actually, I'm a Waterloo alum from the Conrad Business School, and I took the MBET program, the Masters in Business Entrepreneurship and Technology. And one of the reasons why I took that was I sat back and I said, I love, entrepreneurship. I love to create solutions and to fix gaps and whatnot. But I've failed in a lot of ways at it. There has to be a better way. There has to be some structure that I can follow to be successful at this. And that's why I went to MBET. And that, I'd say, was the start of something beautiful in terms of community and ecosystem. I, from MBET, got connected with Greenhouse, which is a social entrepreneurship hub at the University of Waterloo, and then Velocity, and then Communitech. All really great incubators and accelerators that have helped nurture not just my idea, but me as a person as well. I have learned so much about business, but also about myself as a business person, as an entrepreneur, the mentorship and coaching. And, anytime I talk about the ecosystem, as you've brought up, there are few people that I absolutely have to mention. One of them is Tanya, who you know very well. Tanya is, I don't know how many people I've said to, if you've got an idea that you want nurtured, you have to go to Tanya. You have to speak with Tanya. She is just so fantastic at what she does in terms of helping young entrepreneurs frame the riot of ideas in their mind and really frame it in a way that is meaningful, and then support them and nudges and pushes them sort of into the wall and says, I believe in you, go do your thing. And so many others, like that. I've been blessed in that sense to have amazing coaches and mentors from Velocity and Communitech that have just really helped frame again the riot of ideas and keep nudging me and supporting me and say, have you thought about this? And have you thought about that? This is what you're doing wrong. This is what you're doing right. And that is invaluable. Really, that support within the Waterloo ecosystem is invaluable. So if you've got an idea, you want to build something, come to Waterloo.
The selfish plug, yes. As we sort of wind down our conversation today, I really feel that it's important for us to talk about, like you've said, that mentorship piece. But beyond the mentorship piece, how can someone shy about their idea, is sitting on maybe this $1 million solution that can change the world? If you could speak to them directly, what would you tell them about going from just an idea now into the actuality of creating and building your idea?
Don't be afraid to look stupid.
That's a good one.
That's my, what's holding you back? What's on the other side of that fear, that shyness, or what are you scared of? Yeah, you're going to look stupid. So what? So many successful entrepreneurs, it's almost like a rite of passage. You at some point have to ask what might seem like the stupid questions to get to that point where you're now creating solutions that are addressing the core needs of people. So, really, you should let go of those things that are holding you back, like being shy, being scared of failure. You're gonna fail. End of.
True.
Like you have to fail. How else are you going to reach success without failure? How else are you going to know that you've reached success if you've never failed? Right? So being afraid of failure, being shy, being scared, even in some cases I've heard like being scared that someone else might steal your idea, and so you're waiting for the right time when you have $1 million before you share it. It might be too late at that point, right? Just go for it. Don't be afraid to ask stupid questions. Don't be afraid to look stupid, because you're going to have the last laugh.
That's true.
Right? And so I'd say just let go of all of those things that are holding you back and start where you are. Start as small as you can, wherever you are. And you might be shocked how far you'd go.
That's true. Bringing it back to MedInclude, right now you have a great partnership with Grand River Hospital. I'm assuming that you're trying to build many more partnerships in North America, but what is your vision for MedInclude 5 to 10 years from now?
Great question. So the vision is that MedInclude becomes the part of the standard of care for provider-patient communication. Right now, in a lot of instances, the process of provider, so the doctor communicating with patients, whether that is sharing instruction, information, whatever it is, it's mostly manual, it's mostly English-based, it's mostly information just as is with medical and technical jargon contained in there. My hope is that with MedInclude over the next 5-10 years that providers get the support with this platform that they need to engage better with patients and actually have a conversation as we're having. Like, I absolutely understand the questions you're asking me. You understand the answers that I'm giving to you. You're not using, it doesn't seem like you're using coded language. I'm not using coded language, which is sometimes what medical jargon can seem like to patients. And so we MedInclude as that middle interface at the point of care with providers and patients. My hope is that providers get that support without added time to their current workflow, where they can seamlessly communicate with. That's the beauty of technology, seamlessly communicating with the patients as if we were both speaking Spanish, because you can, with MedInclude, speak Spanish to a Spanish patient, even as an English doctor, and so on and so forth. For the patients, I hope that this platform that we've built really brings on new meaning to self-agency, right? Where patients are able to be meaningful partners with their healthcare providers in deciding their own faith, in deciding their own healthcare journey, and all other decisions that they need to make. So that is my belief. I absolutely believe that is achievable and possible, and that's what we're working towards every day.
Thank you. That's a very good vision, a bold vision, and I'm sure that with the work that you're doing, the start that you have, the partnerships, and the support that you have, I'm sure that it is a vision that's going to come to life, come to fruition, and we do wish you all the best. Thank you so much, Seun, for being on the Young Guy International podcast today.
Absolutely.
It's been a pleasure having you. Thank you for coming. Thank you for speaking to so many of the people that are listening and watching today's conversation. It was great having you on.
Thank you so much, Darren. I absolutely enjoyed chatting with you. This is my first podcast.
Oh.
So thanks for breaking me into the podcasting world. Thank you so much.
No problem. You're welcome. And to our viewers, thank you so much for watching this episode. If you're watching it on YouTube, please continue to like, share, comment, subscribe. There's lots of more content coming your way. If you're listening, please come on, watch the episode as well. But still, draw the lessons that you've learned. Seun's journey has taught us a lot about perseverance, grit. And if you have that idea, go out there. I mean, at the end of the day, you will fail, but it's how you pick yourself up from that failure, how you navigate the different obstacles, that makes you this entrepreneur, and that makes you someone that is essentially trying to create a different world than the one that we're living in, a better world than the one that we're living in. So thank you again. Thank you, Seun, and thank you for everyone watching. We'll see you soon.
Thanks. Bye.